I'm Dr. Greg Nigh. Welcome back to the deep dive. And today the dive is into SIBO and sort of the gut and some problems that I've expressed to a lot of patients and in talks. And it's a question that a lot of people have about my opinion on this. So I just want to clarify. And the opinion that I have is that testing for SIBO, small intestinal bacteria overgrowth. Testing for SIBO, in my mind, is bunk. And I've thought that for a long time. And the reason I have thought this is because the results of testing very, very commonly don't jive with the symptoms that people are telling me. I mean, there's more to it, and I'm going to explain that. But it just didn't make sense that people with negative tests had symptoms, people with positive tests didn't have symptoms. It didn't add up. And so I personally had just kind of decided, not consciously, but it was like, well, I don't need to test. Test is not really telling me anything that is actionable, so I'm not going to test. So it's in that context. So that was an opinion that, I kind of came to, whatever, a decade ago, as people with this diagnosis of SIBO started showing up to my practice. More recently, there was a study published in 24, and let me see if I can get this going here. Yeah, okay. So this is the study that was published, and it's a long study. It's a very, very comprehensive, looking at the evidence that. So when we're talking about SIBO testing, we're talking about breath tests. So you give usually a lactulose drink, you wait a certain amount of time, and then you breathe into a bag and you find out how much hydrogen, how much methane, and some tests how much hydrogen sulfide, how much of these gases are coming out. The assumption is that, okay, you take the lactulose, that is a fuel for different kinds of bacteria that produce these different kinds of gases, and you wait the amount of time that allows it to reach the small intestine. And so when you measure it in the breath, you're finding out how many of these bacteria, which are not supposed to be in the small intestine, how many have migrated up into the small intestine from the large intestine and are producing these gases, which are assumed to be causing digestive misery of all kinds. So this test actually went through all of the evidence that's available to tell us whether or not is this really what these tests are accurately showing us. And let me just see if I can uh make this obvious. It's very long, and if you're interested in the fine print, of course, but basically the punchline is no. No, there is no evidence. There's no consistent evidence. It's not that there is not a single study to say it tells us what we want to know, but there are enough conflicting studies that we certainly can't be confident that the test is telling us what we think it is or what SIBO practitioners think it is. Essentially, the conclusion here is that these tests are telling us about transit time. Most of the gases that are coming out in the breath are coming from the large intestine. They're not coming from the small intestine. That is that has enormous implications for treatment. I mean, people are spending hundreds of dollars every month treating what it has been diagnosed as small intestine bacteria overgrowth. And this study right there is saying no, that's actually not what it's testing. I don't know if you can see, in case anybody wants to see the neurogastroenterology and motility. This was in May of 24. So, to then carry that further, my personally, my thinking about pretty much everything in biology is that bodies don't do things uh, in a counterproductive way. Almost any symptom that we might experience, you can trace it back to the body trying to fix a problem. So, okay, here we have SIBO. Let's just start with hydrogen, which is the kind of the first of the gases. I'll show you why I'm calling it the first. It is the primary gas that is being created. So a very large portion of bacteria in the human microbiome produce hydrogen gas. And so this is crucial for two reasons. One is that hydrogen gas is the building block for other molecules that are very important. And the second is that, and I'll show you the article that references this in just a second. Maybe let me just, okay, so here is just sort of an illustration uh, of the role that hydrogen gas is playing. So hydrogen gas, if you just follow this through, you've got hydrogen gas. Some of it is creating hydrogen sulfide. Some of it's creating methane. Remember, those three are the three that are tested on these breath tests. And then some is also going to create acetate, which is important for a lot of other reasons. So there are two things to know about hydrogen gas. One is that while hydrogen gas itself is actually very important biologically, it has many, many healthy properties. Let me see if I can blow this up. Antioxidant, protect the mucosa from oxidative insults, impaired hydrogen gas production can lead to inflammation and even carcinogenesis. So greater risk of colon cancer when there's not adequate amounts of hydrogen gas present. So, okay, that's a good argument that hydrogen gas got something going on. Here, they say hydrogen gas may regulate the anti-inflammatory and antioxidant activities. It actually, now we can say pretty confidently that it does. It benefits mitochondrial energy, metabolism, endoplasmic reticulum stress, the immune system, cell death, all of these things, and has therapeutic potential for many systemic diseases. The punchline is hydrogen gas is not like a waste product. It is incredibly important systemically for helping our cells generate energy, for regulating the immune system. There was a study, I'm not sure if I have the citation here, study showing that hydrogen gas actually especially in the context of autoimmune disease, because it will help to modulate an overactive immune system. So it's not just stimulating immunity, it is modulating immunity. And so there are many studies on hydrogenated water where we're adding hydrogen gas, bubble it through water, and then drink the water because that brings more hydrogen into the body. Now, I'm going to tell you another very important role that hydrogen gas is playing in the body, and that is that hydrogen gas that's being created by these bacteria in the gut is dramatically depleted in deuterium. And I kind of cringe every time I have to say the word because it sounds complicated, because it has to do with chemistry and isotopes. But I've done at least one and maybe two other video on deuterium. Oh, I should and kind of explaining what deuterium is, how it's found in nature, how it comes into the body in our food and our water, and then how it can interfere with our normal healthy metabolism. And so our bodies have many ways of kind of keeping deuterium out of the way and not getting used like hydrogen. So the bacteria in our gut is a primary way of making sure that when we build other molecules out of that hydrogen gas, so like I showed you before, it goes to making hydrogen sulfide, it goes to making methane, it goes to making acetate, and ultimately many other molecules, butyrate and propionate and formate and formaldehyde, even all of those are getting built from hydrogens that are derived from the gas made by those bacteria. And that gas is depleted in deuterium, which means that those molecules that are getting built are depleted in deuterium. And that is incredibly important for normal, healthy physiological function. If that is not the case, if those molecules get made from hydrogen gas that is not depleted in deuterium, so the bacteria are dysfunctional, they're not doing what they should do, it causes this big downstream effect. I think, let me just see if I, no, I didn't include it here. I thought I had it. Um, so the punchline is that I don't do much gut testing. I have treated hundreds of patients with a diagnosis of SIBO who bring me test results telling me that they produce too much hydrogen sulfide, too much methane. I don't need to see test results. My assumption is that people are producing these gases because those gases are functional. They're trying to fulfill a need in the body. And the goal is not to kill the bugs making the gas. The goal is to figure out why does the body need those gases that are being found, and how can we fix the problem so that we don't have to grow bacteria in the gut that generate those gases in excess. So that is just kind of a brief overview of SIBO testing, study to say that it's not telling us what we think it is. We need to stop putting all of our eggs in that testing basket and really get to more functional assessment of the gut and trying to create treatment programs that rely more on understanding the functional role of those gases and how can we even augment or supplement the normal physiology to meet the need that those gases are trying to meet. So, anyway, I hope you found this interesting. Please do like or subscribe or like or leave comments. Of course, anybody who would like to have a more detailed conversation with me, you can always find me at gregnigh.com, and you can schedule through there. And I will be back before long with another session of the deep dive.